Our group is addressing the nursing shortage. Our recommendations are focused on Williams Medical Center, a hypothetical county hospital in a suburb of Nashville, Tennessee. Group members include Kimuko Uryu, Ashley Seymour, Ming Ming Z, Jake Rosenblatt, and myself, Brad Bullock. We will address the market effects of the nursing shortage both nationally and at Williams Medical Center by focusing on two key frameworks: innovation and cultural competency. Stakeholders include patients, nurses, and the community, as well as hospital management and nursing schools we may partner with. Our analysis will point to the consequences of understaffing and low nurse retention rates. We offer insight into means to address the nursing crisis with a primary focus on increasing nurse efficiency through technological innovation. The key performance indicator to be tracked is nurse staffing rates, with multiple quality indicators as secondary measures of performance.
Thanks, Bradley, for starting us off. Healthcare administrators are continually experiencing challenges with hiring and retaining nurses in today's fast evolving world. When evaluating Williams Medical Center, it was important to look at some of their historical data so that we could get a better feel and understanding for their turnover and vacancy rates. As you can see on the left-hand side, nurses left the medical center at a high rate in 2021, increasing their vacancy by 22% and their turnover rates by 11% in a 2-year time span. After evaluating and analyzing similar data, it was determined that Williams, like many other healthcare systems across the nation, were dealing with three major challenges. These included increased pay, which was straining many hospital systems, nurses transitioning from being hospital employed to travel nursing, and finally, the restructuring of nursing duties and staffing models. My colleague Jake will now discuss two successful frameworks that can be implemented to combat these challenges.
Thanks, Ashley. The two frameworks that we feel are most impactful in addressing the nursing shortage are innovation and cultural competence. From an innovation perspective, there are numerous opportunities that have the potential to dramatically change the way nurses approach their work. Product innovation, process innovation, and organizational innovation all represent opportunities to help make nursing more attractive to the workforce while alleviating the existing burdens nurses face on a daily basis. Automation and advanced technological development, such as iPads for bedside charting, telenurses for monitoring fall risk patients, and teleadmitting, helps recalibrate the job design and responsibilities for a nurse in a manner that is more patient-centric and value-adding. Additionally, enhanced policy measures can help manage the burnout many nurses are facing. Introducing a childcare facility and increasing recruitment from nursing schools are the types of programs that make the nursing profession more prominent and desirable. Culture competence is equally as important in establishing and maintaining a well-functioning healthcare system and combating the nursing shortage. Dynamic systems must be in place to ensure diverse values, beliefs, and behaviors are being embraced and supported on an ongoing basis. Specifically at Williams Medical, leadership must divert focus into evaluating whether employee demographics match the patient population. To further establish and entrench diversity, equity, and inclusion, it must extend through the leadership team. As of now, the leadership team at Williams consists of 10 individuals, 4 women and 6 men, all with Caucasian background. This must be an area of further analysis at Williams. Finally, culture competence initiatives must go beyond the service and not appear as performative one-time initiatives. Rather, they must be instilled within the Williams Medical Center's DNA and culture and embraced as a strategic opportunity. From a framework perspective, we feel technological development will be the most significant driver in advancing the nursing profession and combating against the ongoing shortage.
Thank you, Jake. There are 3 ways that we plan to use technology to help with the nursing shortage. One is to use bedside tablets so that the nurses can remain at the bedside, increasing their efficiency and also improving patient satisfaction and nurse job satisfaction. Secondly, we hope to use telesitters, which allows us to use remote nurses who can take care of many patients at once, greatly increasing the cost effectiveness of this process. They can speak to the patients and use verbal cues to keep the patients in bed, answer simple questions, or notify the nurses if needed. Third, we hope to use nurses for teleadmitting. This is still one-on-one nursing, but because it is remote, it is more cost effective than travel nurses, and it allows for the collection of information, even though an exam cannot be done. We hope that through all of these means, we can improve the quality of our nursing as well as the job satisfaction of our nurses and our patients. Now on to Kimiko to discuss stakeholder analysis.
Hospital management department and the nursing educational institutions that have the greatest impact on the nursing shortage problem. Also, many people are interested in the nursing profession. The supply of educational facilities remain inadequate due to aging educators and a shortage of educational institutions. The high cost of tuition fees also discourages some from pursuing a career in nursing. There is a need to facilitate access to the nursing profession by expanding scholarships and diversifying the pathways to obtaining a nursing license. Educational institutions and hospitals need to strengthen their partnerships to further enhance educational programs that are directly related to clinical practice and create a system that sends nurses to hospitals in a sustainable manner. The management team should incorporate people with nursing experience, and a resilient nursing system must be established because the nursing profession is physically and mentally demanding. In Tennessee, nurses have a little authority or autonomy because a set state limit to nurses' work. Many nurses feel that they have no decision-making authority in the medical field. Hospital management should develop a system that fosters a sense of self-efficacy in nurses' work. Work-life balance should be respected so that all people, regardless of race or gender, can play an active role. Hospital management needs to create an environment that facilitates the retention of nurses by more actively incorporating information technology, providing daycare centers, and offering shorter working hours. Over to Mimi to discuss analysis of market change.
One inevitable challenge the industry currently facing is that the nursing workforce is aging. The median age of licensed nurses was 53 in 2020, thus a year older than in 2017, which means a large percentage of nurses expected to retire in the coming years. This will accelerate the nursing shortage and make it even more challenging for healthcare organizations to attract and retain nursing talent. But we also observed the several trends currently in the industry in order to address the problem. One trend is the adoption of technology to enhance patient care and lessen the burden on nurses. This includes the use of electronic health records and telehealth services. This adoption of technology is likely to continue as the industry seeks to improve patient outcomes and reduce costs. Another trend in healthcare is the shift towards outpatient care. This shift is being driven by a number of factors, including advances in medical technology, changes in payment models, and a focus on preventive care. As a result, there may be a decreased demand for inpatient nurses and an increased demand for nurses in outpatient settings. We believe that this shift is likely to continue as the industry seeks to provide care in the most cost-effective and efficient manner.
The Carey Business School uses the tagline, "Business with Humanity in Mind." Our recommendations support this concept. Humanity benefits when patients are well cared for and when those providing the care are seen, valued, and supported. Our solutions support high-quality healthcare and provide economic benefit by improving the financial viability of our hospital.